Just let me know if the audio is clear now. Yash? Okay. So I'm sorry about, it was, I think, playing in the background. Let's start with this question. Hi, Shushma. So a 4-year-old boy. So let's answer this question. A 4-year-old boy of a first degree consanguous couple was noted. So consanguous couple was noted to by the parents to have darkening of urine to almost black color when left standing. Okay. Now he had normal sibling. There are no other medical problems. Growth and development today. Methyl malonate. Can anyone tell me when methyl malonate is elevated? When, in what diseases you will have methyl malonate elevated in the patient? Can anyone tell me? So methyl malonate, very good, very good. Most of you have got this correct. It is elevated in vitamin B12 deficiency. Very good. Homogenticate, what is the disease and what is the enzyme disorder? Can anyone tell me? Homogenticate, what is the enzyme deficiency and what is the disorder? And this is the correct answer also. Are you all able to stream properly? Is the video visible properly? Because I'm seeing a lag here. Very good, Sandeep. It is L captonuria. Okay, and homogenticate oxidase is the enzyme which is it. Phenyl pyruvate, when it will be elevated? Can anyone tell me? Phenyl pyruvate. So phenyl pyruvate will be in phenylketonuria. Okay, and alpha ketoisovalerate. I think there is something. So branch chain ketoaciduria will be in alpha ketoisovalerate. So let's look at the next question. The correct answer here will be and option B, homogenticate. Okay, classically alkaptonuria, generally patient will be normal till second and third decade of life. Okay, and the only symptom till second and third decade of life will be blackening of urine. Okay, darkening of urine. Let's answer this question. Which of the following is true about different structures of protein? This was again a question asked on NEET PG 2020. Till then I'm trying to just locate where the problem is. Why is the video not? Question, everybody. So I'm just trying to get the video back. Just give me 1 minute. I'm just trying to get the filter back. Okay guys, I'm really sorry. I'll just remove my video for a while. Okay, so the correct answer here according to everybody. So which of the following is true about different structures of protein? Okay, so let's look at each one of these. Secondary structure is three-dimensional structure of protein. Now secondary structure need not be three-dimensional structure. Okay, tertiary structure is definitely three-dimensional, but secondary structure generally is two-dimensional or maybe three-dimensional. For example, alpha helix, it is three-dimensional, beta plated is two-dimensional. So this is not a correct sign. Secondary structure is stabilized by disulfide bond. Now remember that for disulfide bond you need to have SH. Now only one amino acid will have SH, that is cysteine. Okay, primarily the major stabilizing force for a secondary structure is hydrogen bonds. Remember this, hydrogen bond either in beta plated structure, like say this is the beta plated structure, hydrogen bonds are the most important bonds. So again this is a wrong structure. Primary, secondary and tertiary structure are destroyed during denaturation. Now this is controversial. Remember, secondary is definitely destroyed, tertiary is destroyed, but primary may or may not be destroyed. So this is also not the complete correct answer. Secondary and tertiary structure depend upon the sequence of amino acid. This is a 100% correct answer. So the sequence of amino acid is what will decide the secondary and tertiary. So the correct answer will be D. Is everybody clear about this? Is everybody clear? Very good. Let's look at the next question. Insulin glucagon ratio is decreased. Enzyme which is active at this time is. So this was again a NEET PG 2020 question. Insulin glucagon is decreased. Enzyme which is active at this stage. Can anyone answer this question? Insulin glucagon ratio is decreased. Enzyme which is active at this time. So first of all, you have to understand what does insulin glucagon ratio means. What does insulin glucagon ratio means? Now we know that insulin is the hormone of fed state. Okay, and glucagon is the hormone of fasting state. Okay, so insulin glucagon ratio means is decreased, which means the body is in fasting state, because if it is decreased, this means that glucagon is increasing and insulin is decreasing, then only this ratio will be decreased. So by this we mean that the body is in fasting state. Okay, which enzyme is active? So glucokinase, hexokinase, both will be active in fed state, not in fasting state. Phosphofructokinase, again this is an enzyme of fed state. Glucose 6 phosphatase, this is an enzyme of gluconeogenesis. Okay, gluconeogenesis. Okay, and this is the enzyme which will be active in fasting state. Okay, so the correct answer, everybody, will be D. Is it clear, all of you? Let's look at this question. Onchorosis is again this was again the question asked in NEET PG 2020. Onchorosis is due to the accumulation of homogenticity acid, phenyl pyruvate, xanthurinate and glyoxylate. Anyone answer? So Shushma is saying A. Anyone else? Anyone else for this answer? So the correct answer here is homogeneity acid. Again, this was a second question on the same year of alkaptonuria. The first question we saw in NEET PG 2020 on alkaptonuria was a case study, and this was the second question. So we know that in alkaptonuria what happens? You know, uh, this homogeneity acid is formed, and this is getting accumulated. So the correct answer will be A, homogeneity acid. Let's answer this question. Bilirubin in serum can be measured by. Bilirubin in serum can be measured by. So such kind of biochemical tests also have started being asked. So bilirubin in serum can be measured by Van den Berg reaction, Ehrlich reaction, Selinger's reaction, and Fauchet reaction. Anyone? Sandeep is saying Van den Berg. So Van den Berg definitely is the correct answer, because Van den Berg, it's a very common test basically. Okay. So can anyone tell me what does Fauchet's reaction is for? What is Fauchet's reaction for? It is basically for bilirubin only, but it tests bilirubin in urine. Okay. It tests bilirubin in urine. Okay, remember this. What is Selinger's reaction? Selinger's reaction. Again, it is not bilirubin, but it is urobilinogen. Okay, urobilinogen. What is Ehrlich reactions for? Anyone? So this again is for urobilinogen or indole compounds. Okay, indole compounds, and this is basically for serum bilirubin. Okay, so remember all these points. Okay, let's answer this question. If a sample DNA, if adenine is 28, what will be the amount of cytosine present? If a sample DNA, if adenine is 28%, what will be the amount of cytosine present? Anyone? Anyone for this answer? Now this is basically on Chargaff's rule. So we know that the amount of A is equal to T and the amount of C is equal to G. Okay, so if adenine is 28%, thymine also automatically becomes 28%. So these two will become 56%. Okay, now if we minus it from 100%, how much we get? 44%. Okay, so 44% is contributed by cytosine and guanine, and both are equal. So if we consider it as X, this is also X. So 2X is equal to 44%. So X will be 44 by 2, that is 22%. So very good Shushma, very good Parag, very good Sandeep, Tanya, Salva, Sindhu. Okay, the correct answer here is D. Very good. Let's look at this question. What is the diagnosis? Drug-induced dermatitis, contact dermatitis, vitamin E deficiency, and niacin deficiency. What is the diagnosis? So what is this disease? Can anyone tell me about this typical, necklace? Yeah, there is a specific term. Can anyone give me the specific term? So the correct answer is niacin deficiency or B3 deficiency, as everyone else has said. But what is this pattern called as? What is this pattern called as? Very good, very good. This is basically Castle's necklace. Now you will be surprised that on this simple concept in past 2-3 years 2-3 questions have been asked, which means every year one question has been asked on Castle's necklace. So the correct answer is D here. Okay, let's look at this. Macular cyst can be treated by excess of which vitamin? Macular cyst can be treated by excess of which vitamin? Anyone? Vitamin A, D, E, or niacin? Macular cyst can be treated by excess of which vitamin? So Sandeep is saying vitamin E, Parag is saying vitamin A. Anyone else? Gia is saying vitamins E. That is option C. Anyone else? Now there has been various studies on this particular A. Okay, there has been various here. Now if you talk about macular cyst, primarily using antioxidant and zincs. Okay, the primary therapy is antioxidant, okay, and zinc. So which vitamin is having antioxidant property? Obviously D is one of the strongest naturally occurring vitamin, and obviously vitamin C can also be there, but it is not here in the option. The correct answer will be vitamin D. Okay, and very high dose of vitamin E, vitamin C and antioxidant is given in these cases. Is it clear all of you? The correct answer will be C, vitamin E. Macular cyst, the main treatment is antioxidant plus zinc. Okay, this was again a NEET PG question. You will be surprised that the similar question appeared both in 2019 and as well as in 2020. Addition of which amino acid will increase UV absorption? So anyone for this question? Addition of which amino acid will increase UV absorption? Silva has properly spelled it out. Tryptophan. Anyone else? Gia is saying proline. Anyone else? Now again, remember all the aromatic amino acids are those which will increase the UV absorption. So what are the aromatic amino acids? One is phenylalanine, the second is tyrosine, third is tryptophan, okay, and the last one is basically histidine. So only these aromatic amino acids, they have a special property that they will absorb UV light, okay, and the maximum absorption is somewhere around 280 to 290 nanometer. Okay, that is the band where maximum UV light absorption will be there. So this is the first point. Second point, all of you should remember that all amino acids are colorless. So because none of them absorb visible spectrum of light, so they do not absorb visible spectrum of light. Okay, so all of them are colorless. They do not absorb visible spectrum of light. So the correct answer here is A. Okay, let's answer this. Richest source of vitamin B12. Richest source of vitamin B12. Is it meat? Is it green leafy vegetable? Corn oil? Sunflower oil? So what should be the richest source? Gia is saying A, Shushma is saying B, Sandeep spelled out meat. Selva also meat. So remember, one of the another very favorite question and very easy way to the most common vitamin deficiency in vegans or vegetarians, that is vitamin B12, because vitamin B12 either it is found by microorganisms, okay, it is completely deficient in plant kingdom, okay, so none of the plant sources will have B12, only animal kingdom sources will have B12. Is this point clear? So richest source will be meat, egg, all those animal based proteins, okay. And remember, vegan and vegetarian are more prone for deficiency of B12. Can anyone tell me what is the second most common vitamin deficiency in vegan and vegetarian? Which is the next common vitamin deficiency? Anyone? Which is the next common vitamin deficiency? Very good, Jia. Very good. Excellent. The correct answer is vitamin D. Okay. Let's look at this question. Which amino acid is used to synthesize nitric oxide? Which amino acid is used to synthesize nitric oxide? Options are glycine, arginine, tyrosine, and threonine. Which amino acid is used to synthesize nitric oxide? So all of you are saying arginine. The correct answer again is, all of you are correct, arginine. Now this is a simple question again. Multiple questions have been asked in 2-3 years on the same thing. There was another question that nitric oxide, what is the enzyme? So can anyone tell me arginine with which enzyme is formed into nitric oxide? What is the enzyme here? Anyone? Which enzyme converts arginine into nitric oxide? Give me an answer. Which enzyme? And so you have to name number one enzyme, and there is very important cofactor also, specific cofactor also, which is asked for this enzyme. Very good. In nitric oxide synthase. Okay, remember synthase, it is not synthetase, it is synthase. And what is the cofactor? What is the cofactor for nitric oxide synthase? Again, a very favorite MCQ, very favorite one liner. Anyone? What is the NEETPG? Yes, but the cofactor I am asking. Coenzyme. Tetrahydrobiopterin. Tetrahydrobiopterin. Okay, so these are the two very important questions. Definitely they are going to ask on nitric oxide. Let's answer this question. True about non-competitive. I am not going too detailed into the discussion. I'm just discussing a lot of questions. True about non-competitive antagonist is. 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 So Mukesh is saying B. Now, before we answer that question, just answer this. Non-competitive antagonist, is it a reversible or is it irreversible? Quickly answer this question. Is it reversible or is it irreversible? What is the nature of non-competitive antagonist? Anyone? Is it reversible? Is it irreversible? Very good, very good. So as long as any antagonism is irreversible, the Vmax will always decrease. Vmax will always decrease. Always decrease. When it is reversible, okay, Vmax will remain the same. Vmax will remain the same. So here if you see Vmax remain the same, Vmax increases, all these options immediately go out of question. The correct answer is A. Is it clear? Is it clear all of you? Oh, okay. Now coming to KM. Any antagonism which affects the enzyme substrate interaction, they will affect the KM. Okay. Now anything which is acting on the active site. Okay. What are the inhibitions which are active on the active site? Suicide inhibition and competitive inhibition. So in both of these, KM value will increase. Okay. And second, even in allosteric inhibition, even though the inhibitor adds itself on the allosteric side. So inhibitor is adding here. This is our active site, but this acting here will change the conformation of the active site. Okay. So allosteric inhibition also, KM will increase. Is this point clear? Is this point clear, all of you? Very good. Let's look at this question. All of the following are dietary fiber is insoluble in water except. All of the following dietary fiber is insoluble in water except. Let's answer this question. All of the following dietary fiber is insoluble in water except pectin, lignin, hemicellulose or cellulose. So Nirja, quick to answer. She is saying pectin. Anyone else? Lignin. Selva Lalu is saying lignin. Anyone else? So we have a split between pectin and lignin. Hemicellulose. Now remember, both cellulose as well as hemicellulose are not soluble in water. They are insoluble in water. They are definitely insoluble in water. So pectins, cum, mucilage, okay, all these are water soluble. Okay, so the correct answer will be A. Okay, for lignin, remember, a very important, it is neither digested, okay, nor fermented by in human. So the question they will ask about lignin is, which of the following is neither digested nor fermented? Digestion is, remember, by digestive enzymes. Okay, digestive, and fermentation is basically by our microorganisms in our gut microorganisms. So lignin is neither digested nor fermented in our. Is this point clear to all of you? So that is the high point about lignin. Okay, and lignin now has a lot of therapeutic value, which we will discuss later. Correct answer here is A. Very good. Let's answer this question. Werner syndrome is associated with premature aging and it is caused due to the defect of which of the following? So basically they are asking which of the following deficiency will cause Werner syndrome. Anyone? Which of the following Now Werner syndrome does not have, so most of you are going for telomerase. One person has gone for A. Anyone else? Anyone else? So remember, Werner syndrome has nothing to do with telomerase. It has to do with helicase. So the correct answer is D. Okay, the correct answer is D. So Mukesh is correct. Okay, Mukesh is very correct. He knew the answer. The correct answer is D. Okay, all of you, very good. So let's answer this question. Carbon atoms added in fatty acid synthesis. Carbon atoms added in fatty acid synthesis. So how many carbon atoms are added in first and the second cycle and onwards? Let's answer this question. Carbon atoms added in fatty acid synthesis. So Lalu is saying B, 4 in first cycle, 2 in second cycle. It's 2020 again, B. So almost unanimously everyone is saying B. Okay, almost unanimously everyone is saying B. The correct answer here is actually B. Okay, so what happens when for the first time, now here is our condensation and here is our malonyl CoA acceptor. For the first time acetyl CoA goes here and malonyl CoA comes here. Okay, and this malonyl CoA, the moment it is going here for it will lose the carbon dioxide plus CoA. Okay, and here for the first cycle 4 carbon skeleton will be formed, and that will go in the first cycle, and from next cycle onwards only 2 carbon will be added. So the correct answer, I have not gone too much into detail, the correct answer is 4 in first cycle and 2 in second cycle and onwards. Now we know that this session has been sponsored by Unacademy, and Unacademy has a very vibrant NEET PG platform. Unacademy is one of the top online educational platforms, and many students are still wondering if Unacademy subscription is right for you or not. Now remember, you have a lot of institutes which are providing you recorded sessions, but recorded sessions are just a little better than actually reading books. They require a lot of personal motivation. There is hardly any interaction, and there is no group learning. Learning happens when you study in group. Like here, almost 25-30 people are answering. Okay, this is a commercial break, please don't go away. We will again continue our NEET PG. This is a 1 hour session, so I'm just saying that recorded videos require a lot of motivation, and when you see even the learning, there's an absolutely accelerated learning when you do it in an interactive environment. The best part about this interactive environment is that every student interacts, the peer pressure to be wrong or right is removed in this online platform. There are several top educators, many of you have attended their classes, all of those access are there. They are all live every day, taking various sessions for all of you on various topics of your choice. All the courses in the Plus platform is very structured. So suppose if I am taking biochemistry and it's a foundation course, so I'll take you from zero and take you to the hero level. So every concept I will start from the basic and take you to the absolutely highest level and everything in between, along with solving of MCQs. So there is a structured course, there is doubt clearing session. You have any doubt, you post it to us and we answer it. There's an absolutely amazing test series which is on Unacademy platform, and no matter what is your focus examination, either you are focused on FMGE, JIPMER, PGI, AIIMS, or you are targeting for NEET PG, there is special batches for every examination. Okay, so your special needs are also taken care of. Okay, so in FMG batch we'll be focusing primarily on all the FMG concepts. In NEET we'll be focusing on NEET concepts. So it's not just covering of syllabus, it's also preparing you for the right examination. Also, because this is more of a discussion oriented platform, it is also the best next ready platform. When next comes, it will be more around concepts and clinical scenarios where discussion is more required. So in case you know how to subscribe, you are all there on Unacademy app, or you can just download the Unacademy Educator app, Unacademy Learner app, and you can choose NEET PG category, and once you are there you can choose which pack you have to. There is a 3 month, 6 month, 12 month, and 24, 36 month pack. Any pack which you are planning to do, you can use this discount code Dr. Abhishek 10. It will give you additional 10% off. Anyone has any doubt about Unacademy subscription? If you can shoot. Anyone who is first year, second year, third year. If anyone is first year, second year, third year, trust me, make this decision to join Unacademy. This is a single most, I have many students I have talked personally, asked them, they were very skeptical कि sir join करने से क्या फायदा होगा, अभी we are still in first second year. The moment they have joined, within 2 to 3 weeks they have called me, sir, thank you so much that you have actually forced me to join it. Because what happens when you go to your batch and suddenly your knowledge level is so high as compared to other batchmates? Other are struggling to pass an examination to learn, and here, just by listening to these lectures, you already know those concepts at the back of your hand. So anyone who is in first year, second year, so Aniket, I mean, especially if you're outside the country, there the support even is worse. Even you may not have good faculty for every subject, and Unacademy will ultimately help you prepare for your FMG and any entrance examination, which will help you for licensing also. So trust me on this. I mean, I can only vouch personally. I have trained students for almost 12 years. This is my 12th year running for training people for PG entrance examination. And trust me, I feel it's a very powerful platform. And for the same classes, let me tell you, if a 3 to 4 month program of NEET PG was there, student used to push 60,000 to 1 lakh rupees. And today at Unacademy, if you pay 36,000 rupees, you will get an access of 3 years. Imagine, just 1,000 rupees per month. And the beauty of the plus course is that everything is structured. You will waste a lot less time. Okay, we cannot take everything on this free platform. It is neither but you get a sense that what is live teaching all about. Will you benefit or not benefit from live teaching? So these are some advantages. Okay, anyone has any question regarding Unacademy, feel free. It's not that if you will not join, I will stop this class. We are anyways taking this class, right? But the point is that if there is something which we can do to help you further, and remember, it's not just you. Someone else is joining, someone else is taking the benefit of this platform, and by the time you decide, you may always already be lagging behind. Okay, so I mean, all up to you. You can use this code, any code of your any favorite teacher. That's a separate issue. But join Unacademy. And if you are a first, second, third year student, go for longer packages. 3-year package will cost just 36,000, and that also Unacademy gives an option of converting into EMI. So it's very affordable and it's very elaborate. You all know that. Anyways, let's come to this. So this was the next question which I was saying, that nitric oxide, again, I told you that in 2020 it was asked, 2019 also it was asked. Nitric oxide is formed from which amino acid? Try and answer this question. So all of you are clear now. The correct answer is arginine. Absolutely no doubt about it. So hyperammonemia inhibits TCA cycle by depleting. Hyperammonemia inhibits TCA cycle by depleting. Anyone? So I hope this D answer is for the last question. What is the answer? Mukesh is saying B. Anyone else? Shushma is saying D. Moksh is saying B. So there is a very close split between alpha ketoglutarate and fumarate. So let me just explain you. So what happens? You know that alpha ketoglutarate accepts ammonium ion, and what does it form? It forms glutamate. Again, glutamate accepts ammonium, okay, and form glutamine, and this glutamine will go to liver, okay. In the liver, it will again break down into ammonium and get back as glutamate, and this cycle will continue, okay. When there is hyperammonemia, when urea cycle disorders are disturbed, so this step, the breakdown of glutamine to ammonium, is not happening, okay, because there is already excess of ammonium. So what will happen? Ultimately, this reaction will only fall in this direction. So there will be a depletion of alpha ketoglutarate, there will be a depletion of glutamate, and there will be an increase in glutamine level, okay. And you know that alpha ketoglutarate is very, very central to TCA cycle, and hyperammonemia inhibits TCA cycle by depleting alpha ketoglutarate. Is everybody clear about this question? It's a very important concept. Multiple times this has been asked. Why I am taking this session is that you should know what are the important concepts. Everything is not important. Okay. Let's answer this question. This was again a NEET PG 2019 question, again on urea cycle disorders. Last question was also on urea cycle disorders. So glutamine is increased in CSF, blood and urine due to the deficiency of. Now this is a little controversial question. So let's answer this question. Glutamine is increased in CSF, blood and urine due to the deficiency of. So Moksh is saying A, Neha is saying A, 2020 is saying, why not OTC? Why not OTC? Will glutamine level will not be increased in OTC? Frankly speaking, both CPS1 and OTC deficiency are called as hyperammonemia. This is called as type 1 and this is called as type 2, and they are both almost equally severe. Okay, they are almost, and in both the cases glutamine level will be increased both in blood, urine and CSF. But because we have been forced to choose one, the correct answer will be CPS1. Because if you see the urea cycle, the first step is when ammonium and carbon dioxide will form with the help of CPS1 will form what? Can anyone tell me what will be formed here? Carbamyl phosphate, and this carbamyl phosphate will accept ornithine to form citrulline. Okay, now if you see, if this enzyme is absent, if you see, if this enzyme is absent, okay, then none of the ammonia will enter into urea cycle. So there will be a more increase in ammonia and glutamine level. So the correct answer will be CPS1. Is it clear, all of you? In OTC deficiency also it will be increasing, but because you have been forced to choose, it will be only one answer. Let's look at this. All of the following enzyme involved in heme synthesis are found in mitochondria except. All of the following enzymes involved in heme synthesis are found in mitochondria except. So it's 2020. All of you are, are you all copying answers? Everyone is suddenly saying ferrochelatase. Okay, remember, for heme synthesis, the first step and the last three steps takes place in mitochondria. So basically remember, heme synthesis starts and ends in mitochondria. Okay, so what is the first step? Glycine plus succinyl CoA will give ALA, delta ALA. Okay, this is the first step. So this takes place in mitochondria. And what are the last three steps? So in the last three steps, there is two, you know that mitochondria is very rich in oxidation. So last two steps is basically two oxidation and addition of iron. So these three steps will take in mitochondria. So the correct answer here will be D. Is everybody clear? Simple way to remember is mitochondria is rich in oxidation. So last three step will be CPG will be oxidized. Okay, and again protoporphyrogen will be oxidized. Okay, to form porphyrin, and porphyrin iron will be added. So first step and the last three steps happen in mitochondria, rest all in cytoplasm. Is it clear, all of you? Any doubt? Okay, so the correct answer here is D. Let's look at this. The Krebs cycle and urea cycle. So see, in the same year, this is the third question on urea cycle. Okay, so urea cycle is a very, very high yield topic. Okay, in Krebs cycle and urea cycle, the linking amino acid is. In the Krebs cycle and urea cycle, the linking amino acid is. Now, does aspartate even participate in Krebs cycle directly? Should not be amino acid, the linking molecule it should be. The linking molecule. Forget about amino acid because it's not an amino acid. So the correct answer is fumarate. Okay, fumarate. So in urea cycle, there is a step when hydrolysis happens and fumarate is formed. That fumarate goes into Krebs cycle. Okay, that fumarate goes in, and that is why we call it as Krebs bicycle or urea bicycle. Okay, so I think there was a little confusion around this word amino acid. I don't think amino should have been. The correct answer should be molecule. Okay. Is it clear? And if amino acid was there, then definitely all of you are correct. The correct answer should have been aspartate. Okay, let's answer this question. Which biochemical reaction does not happen in mitochondria? Which biochemical reaction does not occur in mitochondria? Anyone? Good, Neha. Let's answer this question. Which biochemical reaction does not occur in mitochondria? So, all of you are correct. Fatty acid synthesis does not occur in mitochondria. It is a completely cytoplasmic process. Okay. Urea cycle, we have seen it will happen here. Krebs cycle also completely here. Gluconeogenesis also some part. It starts in mitochondria. The correct answer is D. Fatty acid synthesis. Let's answer this question. Serotonin is known as. This was a NEET PG 2018 question. A very simple question. Serotonin is known as. So almost unanimously everyone has, it is 5-hydroxytryptamine. Okay. Whenever decarboxylation will happen, we know that this is the general structure of amino acid. Okay. COOH, H and NH2. Okay. So this is our what we call as amino acid, because there is a acid group, there is a amino group. Suppose decarboxylation happens for any amino acid, what we are left is R, C, H, H and NH2. So this becomes an amine, okay, because the acid part is gone. So that is why it is tryptamine. Okay, the correct answer is B. Let's answer this question. Tyrosinase 1 is caused by deficiency of which enzyme? Hi Nitish, welcome. Tyrosinosis 1 is caused due to deficiency of which enzyme? So again I am getting a unanimous response. So fumaroacetoacetate hydrolase, okay, the last enzyme which will break down into fumarate and acetoacetate. Okay, this acetoacetate will go into ketogenesis, ketogenic pathway, and this will go into TCA. Okay, that is why tyrosine is both glucogenic as well as ketogenic. So the correct answer is A. Okay, let's answer this question. Rate limiting enzyme for bile acid synthesis is? Yes. Rate limiting enzyme for bile acid synthesis is? So again I am getting unanimous response. It is 7-alpha hydroxylase. So all of you are correct. The correct answer is 7-alpha hydroxylase. Okay. Is it clear? So cholesterol, with the help of 7-alpha hydroxylase, will say 7-dehydrocholesterol, and that will go for bile acid synthesis. This reductase is for cholesterol biosynthesis. Okay. HMG-CoA synthase is for ketone biosynthesis. Okay, and sterols is for steroid hormones. Okay. Increased VMA is excreted in urine in which condition? Increased VMA is excreted in which condition? So VMA is basically vinyl mandelic acid. Okay, so this is basically the breakdown product of catecholamines, especially epinephrine and non-epinephrine. Okay, so in any condition where this catecholamine synthesis is increased, their VMA will be increased. So the correct answer will be pheochromocytoma. Okay, pheochromocytoma. Very good. Right. Let's look at the next question. In lead poisoning, there is inhibition of some enzyme of heme biosynthetic pathway. This is reflected by accumulation of what substance in blood? So what is accumulating in blood in lead poisoning? So porphobilinogen is according to Nitish. Okay, Nitish has changed his option. He is now going for D. Almost unanimously, everyone is going for D. So my second question is, there are two enzymes which are inhibited by lead poisoning. Which are those two enzymes? Which are the two enzymes? Okay, ALA dehydratase is the easier answer. What is the next enzyme which is inhibited? Okay, ferrochelatase. Ferrochelatase. Very good, Nitish. And this is majorly inhibited, but this is also inhibited. Okay, majorly prime enzyme to be inhibited is ALA dehydratase. Okay, and then secondarily ALA chelatase will also be. So this was today's session, all of you. Okay, this was, I have been so this entire last 7-8 days I'll be trying to cover some similar similar sessions, as you know. So these are the special classes which I have conducted on Unacademy platform. Amino acid, protein, carbohydrate, lipid, all of these are 2 sessions, okay, MCQ based, and these already have been completed, so you can actually go ahead and see the recorded version. Okay, these are all free classes for anyone who is not even a Plus member. Yesterday I took purine. Now today in another 15 minutes at 10:15 I will be there on Unacademy platform. Molecular biology, again a very important topic, and again I will be discussing just the MCQs here. So in an hour I will be trying to complete around 30 to 40 MCQs, because I am getting a feedback that I should be discussing less answers and more giving you options of question. So this is regarding this, and this is for YouTube. So already 1 and 2 today I have tried to take 2 sessions. Now remember, if you like today's session, you will definitely love all the other sessions, because all the important, and remember, even though these questions may be simple, but ultimately question will come from these topics also only. Okay, when you open the book or your notes, there are so many things which we teach, because we want to cover everything, but 70 to 80% of the questions will come from high yield topic. Okay, and my idea of these NEET PG sessions is so that you can have 80% 70% question can be answered from these sessions only. Okay, so thank you so much all of you. Today's session was a little disturbed because the video was not working initially, but thank you all. Thank you Mukesh, especially. Let me see, there were so many. Thank you Sandeep, Selva, Grace, Krishna, Shushma, Nidhi, Jia, Sindhu, okay, Lalu, again Jia, Shivani. So many people have participated in today's session. Kamlamma, Krishna, Sindhu, Nijat, Sandeep. Okay, then Mukesh is there. It's 2020. You have got some of the very difficult questions correct. Aniket was there. Sindhuja, Neha came late, but she gave most of the question answered correctly. And then Devi, and obviously Nitish joined a late, but again he is an expert in biochemistry. I really wonder what he keeps on coming and completely answers every question. It's such a wonderful seeing him in Animo time. So thank you everyone. Arun, I've tried to thank all of you. Keep attending these sessions. Thank you all, and see you again in tomorrow's session. Okay, tomorrow. So just if you are free, then 10:15 just join me at Unacademy. Okay, there we will discuss questions on molecular biology. Take care. Thank you guys. Thank you so much.